Am I audible? Hi everyone, am I audible? Hi everyone, I hope you all are doing great and I hope you all are in good health. So tell me, guys, today this is the part third of breathing and exchange of gases, and the topics that we are going to cover today, we'll be discussing about the alveoli, we'll talk about the mechanism of breathing, we'll talk about the different respiratory volumes, pulmonary volumes and respiratory capacity. So this is what we are going to discuss. Okay, so I hope you guys are revising. I know the yesterday I was not able to take the session due to some internet glitch, but today, yes, we will. So let's continue this. Let's discuss this. So today, as I said, we will start with the alveoli, right? And then we will talk about the mechanism of breathing. We will be discussing the respiratory volumes and the pulmonary capacities. Done. So do you have any doubt from the topics that we have covered so far? Yes. Yes. Do you have any doubt from the topics that we have covered so far? Yeah, health is good. How are you all? Good, great. Chali. So let's start, guys. So we'll start with the diagrams first. Okay, we'll start with the diagrams first. So here you people can see in the last class also we discussed about the lungs. We know that lungs are present in anatomical airtight chamber, and what do we call it? We call it as thoracic cage. Okay, what do we call it? We call it as thoracic cage, or you can also call it as the thoracic basket as well. Is that clear? You can call it as thoracic cage or the thoracic basket. That's what we discussed in the last class, isn't it? Right. So today we will have the NCERT reading as well. So here you people can see the diagram, right? Can you see this? Right, this is the larynx. This is the larynx having the thyroid cartilage, right, cricoid cartilage. So this part is basically the epiglottis. So when you see the NCERT, you find a diagram like this. So yes, from the NCERT, each and every diagram is important. So you people should know the namings. Then here you guys can see the trachea. You know that at the level of fifth thoracic vertebrae. That's what we have already covered. So at the level of fifth thoracic vertebrae, they will bifurcate into primary and secondary bronchi, then further primary bronchi and then secondary, then tertiary, and further the bifurcation will be there. Okay, so here you people can see this is your right lung because it is shorter, it is broader, it is having these two fissures which are going to divide it into three lobes, right? And here you have the left lobe, left lung having this oblique fissure which divides it into two lobes, and we have discussed it that this one is longer and narrower, the right lung is shorter and broader. And the space between two lungs, what do we call it? We call it as mediastinum. We know that here we have the heart in the center, a bit pushed towards the left side, so that's why left lung is having the cardiac notch. Do you remember this part? It is from the last class. So basically right now we started with the revision part. Okay, yes everybody, is that clear? Beta, syrinx is the voice box. Syrinx is the voice box in the case of birds. Birds are having syrinx. Birds, they do have larynx, but that is not the true larynx. That plays no role in the sound production. Birds have syrinx. In their case, who's going to produce the sound? In their case, that will be syrinx. So here you people can see, right, the further, further division. And then here we have the diaphragm. You can see this diaphragm. So it is dividing this thoracic cavity and the abdominal cavity. So in the case of these lungs, we know that the anatomical air chamber, anatomically airtight chamber is there. So dorsally, it contains thoracic vertebrae or vertebral column, I would say. Ventrally, sternum is there. Laterally, ribs are there. And here you will see right? This side is having the diaphragm, a unique feature to the mammals. Is that clear? Is that clear? And even in the case of lungs, I'll show you the other diagrams as well. You people can see this, right? I hope it's clear to all of you. Can you see that? Can you just see that? Right? So see this. The way it is bifurcated, right? You can see the right lung. You can see the left lung here. So look at the larynx or the epiglottis part here. So that's how it is. Okay? So that's how it is. Is that clear? Is that clear? Just have a look. Have a look. So I hope the diagram part is clear to everybody. Yes, please. The diagram part is clear to everybody. So you can see the ribs. They are protecting the lungs. Okay, as you know, diaphragm, and this is the all arrangement. So even in our book, NCERT, right, you'll see that they show some cuts like this, right, which are named as ribs. So they are cut away to show you this part. So have a look. Okay. Done, students? Sure? Are you sure? Okay, great. So now let's move to the next part, right? And see this one more diagram. Can you see that? Right, trachea, start of the bronchi. So it is like this. Done, students? Done? Okay. So let's start. Let's talk about the alveoli. Okay. So we know that in the last class we are done with this part, this structure and all. And one more thing I would like to add, and I would like to discuss again. Students, basically the point is that, see, lungs, they cannot control their volume. Okay, like within the lungs, pulmonary cavity is there, but they cannot control their volume. Okay. So lungs are having, just a reminder, okay, lungs are having what? Lungs are having outer parietal membrane. You can watch the last part, you will have the better clarity then. Outer parietal pleural membrane, yeah, pleuron it is, and we have inner visceral membrane or visceral pleuron, right? So in between you have pleural cavity, and that pleural cavity is having pleural fluid. Are you getting my point? So of course, this part, this outer one will help, right? This outer one will basically will attach these lungs. This outer one will attach these lungs to what? To the, of course, to what? To this thoracic cage, right? Right. And the inner part, inner layer is obviously with the lungs here. Right. So it is like that. So basically the point is, when there is a change in the volume of the thoracic cage or the thoracic chamber, we see the change in the volume of the pulmonary cavity as well. So that is how they are related. Like if the exam is tough, the cutoff will be low. If the exam is easy, the cutoff is going to be high. So they are like, one is increasing, another is decreasing. But here in this case, what is happening? If there is a change in the thoracic cavity, right, that change will reflect in the pulmonary cavity. Let's suppose if there is an increase in the volume of the thoracic cavity or the thoracic chamber, so that will reflect even in the pulmonary cavity. The pulmonary cavity will also show an increase. So that is how it works. Okay, students, that is how it works. Is that clear? Is that clear? Okay. So now let's talk about the alveoli, right? So alveoli, we know it very well. This is the primary site for the exchange of gases, isn't it? It is the primary site for the exchange of gases, this alveoli in the lungs, right? Primary or the main site. So we know that they are the structural and functional unit of lungs, isn't it? What are they? They are the structural and functional unit of lungs. And of course, if they are meant for the gaseous exchange, they need to be highly vascularized, and they should have what? They should have the thin layers. They should have the thin epithelium. So this is something we need to remember. Okay. So the first point is that it is a structural and functional unit of lungs, the primary site for the exchange of gases. Right, students? primary site for the exchange of gases. So each alveolus is thin walled, highly vascularized. Highly vascularized means it is having abundant blood supply. What does it contains? It is having abundant blood supply, right? So this is what it is. Is that clear? So wall, this alveolar wall, you will see that it is made up of cells, of course. So alveolar wall is having, there are many cells. Let's talk about the type 1, pneumocytes. They are smaller and they help in gaseous exchange. How do they help? These are the cell, students, that are going to help in gaseous exchange. Is that clear? They are going to help in gaseous exchange. Is that clear? Is that clear? So these are pneumocytes, type 1. Okay? Okay? Done? So next, other is type 2 pneumocytes. They are larger and they release what? A surfactant. Right, students? What will they release? They will release a surfactant. Right? What is the name of that surfactant? This is a very important question. Kindly write down. Surfactant, lecithin. Right? What will they provide? They'll provide the lecithin. They release it. So lecithin is the most abundant phospholipid. Okay, it is the most abundant phospholipid. So what is the point here? So it releases, right? What is the point here? It releases, basically type 2 pneumocyte, they release the surfactant. So we are calling it as lecithin. It is the most abundant phospholipid. So it will do what? It reduces surface tension and will protect the alveoli from getting collapsed. Is that clear? Right? Is that clear? So type 2 pneumocyte, basically, so they release the surfactant, as I said. Yes, students. So it releases the surfactant, right? So that is a phospholipid, the most abundant phospholipid it is. So it reduces the surface tension of alveoli. And how will it help? How will it help? Yes, please. Prevent it from collapsing. Okay? So reduces surface tension and protect alveoli from collapsing. And not just these two types of cells are there, other types are there. I'll pick up one, and there you will talk about the, yes, so alveolar macrophages. So macrophages are also there. You know that what is the function of macrophages? Macrophages are basically what? They are the phagocytes, right? They will engulf the foreign particles. So dust particle and all will be destroyed by the alveolar macrophages. So yeah, alveolar macrophages are also there. So yeah, these cells are important. About the lecithin, this is again a previous year question. You need to know that. And when we talk about the alveoli, we know it very well that it is the primary site. Is that clear? Is that clear? Sure? Okay, so if I talk about the number, right? If we'll go as per NCRT, number of alveoli in both the lungs. So number of alveoli in both the lungs, it is around 300 to 400 million in both the lungs. It's not in one lung, but in both the lungs, this is the number that you people are going to see. Is that clear? This is the number that you all are going to see. Understood? So that's what you have. Okay, that's what you have. This is about what? This is about your alveoli. Is that clear? And overall, you know that it is a respiratory system in our body that will form late. Why? Because obviously when we are in our mother's womb, placenta is there to do that job. So it is a respiratory system that develops last. And even when we take the birth, when we come out, within few seconds we start breathing then. Okay, we start breathing then. So this part is clear. Yes, everybody, this part is clear? Sure? Done. So on the outer side of the alveoli, you'll see yellow fibrous connective tissue. That is also something that you people are going to see. So this is all about the alveoli. Is that clear, students? This is all about the alveoli. Okay. So you can even read the NCERT here. You guys can see this here. Okay. So this part also we have covered in the last class. See, lungs are situated in thoracic chamber, anatomically airtight chamber. So thoracic chamber is formed dorsally by vertebral column, and to be more specific which vertebrae they are the thoracic vertebrae, then ventrally by sternum, laterally by ribs, and on the lower side you'll see a dome-shaped diaphragm. So diaphragm is unique to mammals. I believe we have discussed in the last class. Yes or no? Yes or no? Yes or no? Tell me quickly. Done? So the anatomical setup, right, of lungs in thorax is such that any change in the volume of thoracic cavity will be reflected in the pulmonary cavity. So this is very important, okay? This is very important. So this part is done. So now the next topic that we have to start is mechanism of breathing. Okay, the next topic that we need to start is, it is the mechanism of, it is the mechanism of breathing. It is the mechanism of, just a minute, it is the mechanism of breathing. So that's what we need to discuss, and trust me, it's very easy. It's very easy. So this is important as well. Okay, beta, if you really want to crack the NEET, yes, the time that you have is like, obviously it is sufficient enough to crack this exam and to get admission in a medical college, in a government medical college. But it depends at what level you are. Like some students, they are like, we have just started, but they have studied some things in 11th or in 12th. It's like they are not consistent. For them, obviously it is easy if they will make a schedule and if they'll follow it. But the point is, if you think, no ma'am, I'm just a beginner, I'll start from the zero, you can just give it a try, right? You can literally give it a try. But if you think, no, you will just give 7 months, and if your basics are not good, if your basics are good, then you can manage. But if your basics are not good, of course it's not possible. Right? Students are not stupid now. Those who are preparing for from last 2 years or the 3 years, they are not stupid. They are devoting that much time. So obviously, right? They are devoting that much time. Obviously, this time is needed. Okay? Done. So now let's discuss the mechanism of breathing. Okay? Mechanism of breathing. So before that, like we need to talk about some muscles. Okay? What are we going to discuss first? We'll be talking about some muscles that are going to help in this particular process. Okay, done. So I'll start from the basics first. I'll not write anything initially like proper notes. No. I'll just explain you the topic first. See, students, listen to me. Right. When it comes to the breathing, obviously, what are we going to do? Inspiration, which we call as inhalation. And then we have the expiration, which we also call as exhalation. Means you have to inhale, you have to exhale, you have to inhale, you have to exhale. And see, I'm talking to you, right? I'm without my conscious effort, still I'm breathing. It's not like that I'm not. Okay, it's not like that I'm not, right? I'm breathing, right? So because it is important, isn't it? It is important. So what exactly is happening here? So basically you are inhaling, you are taking oxygen in here, you are releasing CO2 out because it is our metabolic waste. But before understanding this part, before talking about this particular portion, we'll discuss few other terms, other things, then we'll relate it. First of all, see, yes, this is a point that here we need what? We need the diffusion, right? The diffusion of gases is required, right? The diffusion of gases is required. Basically, if in our atmosphere, right, if in our atmosphere, if there will be high concentration of the gas, and if within your lungs, within your pulmonary cavity, if that will be low, so you know that gases, they will move from higher concentration to the lower concentration. This is what diffusion is. Gases are diffusing, right? HSP sir, long time no see. So like gases are diffusing from their higher concentration to their lower concentration. Gases are diffusing from their higher concentration to their lower concentration. This is the basic that we know. Right, so HSP sir is here in front of him. Though these are basic concept, but HSP sir, correct me if I'm wrong. Okay, so this is what we have. Okay, this is what we have. So what am I saying? That obviously that is how you are going to inhale. But in the atmosphere, you just don't have the oxygen. We need the oxygen for the oxidation of food, but basically we have the air, isn't it? We have this air. So air is having, air is what? Air is the mixture of gases. Air is what? Air is the mixture of gases. Here you have carbon dioxide also, right? Oxygen also, nitrogen also. We know it very well. So what do we need? We need oxygen, isn't it? We need what? We need oxygen. Yes or no? So what is going to happen here? So obviously we'll again and again say that oxygen will come inside, CO2 will go out. So of course in the air you have many gases. So now you are talking about the oxygen. So when you talk about the pressure, see, like air is a mixture of gases. That's what I said. Firstly you understand the basics, then we will discuss it. Air is a mixture of gases. So of course each gas is having its own pressure. But I am talking about what? I am talking about the oxygen. I'm talking about the oxygen. I'm talking about the individual gas there. So I will not use the term pressure. I'll use the term partial pressure, because I'm talking about the pressure of a component of that mixture, right? I'm talking about the pressure of the component of that mixture. Is that clear? Is that clear? Yes or no? Is that clear? So that is something you have to keep in your mind, number one. So we'll be talking about the partial pressure of oxygen. We will be talking about the partial pressure of CO2 here, number one. So diffusion done, this done. Now, again and again, I have repeated one line that if there is any change in the volume of the thoracic cavity, that will reflect as a change in the pulmonary cavity as well. If volume of thoracic cavity is increasing, the volume of pulmonary cavity will also increase. That is what we are talking. Yes or no? That is what we are talking. Like let's suppose if I have increased the volume of the thoracic cavity, so I can say that the volume of pulmonary cavity will also increase. If I will decrease the volume of the thoracic cavity, so obviously the volume of pulmonary cavity will also decrease. But how does it matter? Right? How does it matter? Like why are we talking about it? It's very simple. So here, before going forward, we'll be talking about the Boyle's law. Okay, we are going to talk about the Boyle's law. So in simple words, right, in simple words, what this law states, that if volume will increase, right, then pressure decrease. If pressure increase, then volume decrease, right? So basically, if volume increase, pressure decrease. If pressure increase, then volume decrease. Basically, they are inversely proportional to each other, isn't it? Isn't it? They are inversely proportional to each other. Yes or no? Yes or no? Yes or no? Right? So this is what Boyle's law is, that volume will increase, the pressure will decrease, pressure will increase, the volume will decrease. That's the point. Now see, I want to inhale. I want to take the air in my lungs, isn't it? Isn't it? So obviously we want this thing now, that in the air, the partial, that in the air, basically what is this? The diffusion needs to be there. The diffusion needs to be there. So if in the air, basically what's going to happen? If in the air, what is going to happen, students? If here the pressure will be more, right? Because we have to develop a gradient here. So let's suppose if here there will be the more pressure, and within the lungs, if there will be the less pressure, so definitely air will come. Yes or no? Definitely the air will come. So that's what you need to do here, right? That's what you need to do here. So that is why. So if I need to, so if let's suppose if I increase the volume of the pulmonary cavity, then we know that its pressure is going to decrease. So if its pressure will decrease, outside there will be more pressure, inside there is less pressure. So inhalation will occur or not? Yes or no? Yes or no? We'll make the notes. Firstly, understand the basics. Yes, please, understand the basics. Is it going to happen? Yes or no? Yes? Yes or no? So basically, what I need to do here? I need to increase the volume of the pulmonary cavity. And I know that it is directly related to what? It is directly related to the thoracic cavity. Right, so if I'll increase the volume of the thoracic cavity, then obviously there is an increase in the volume of the pulmonary cavity as well. So if volume will increase, the pressure will decrease, the air will come inside. Right, the air will come inside. Right, the air will come inside. HSP sir, I don't have that power, I cannot. So ignore them. Right, we'll call you after class, sir. Okay, so this is what we have. So how are we going to do that? Now we need to talk about the muscles. Right, look at this structure. Look at this structure. We have already discussed that the lower side is having the dome-shaped diaphragm. Right, we discussed that the lower side is having the Dome-shaped diaphragm. Number one. Number one. We'll elaborate it more. Number two. These are the ribs that you have. Yes or no? Yes or no? How many pairs of ribs do we have? 12 pairs. 12 pair of ribs we have, means total 24 ribs are there. So you have the ribs here, yes or no? So between these ribs, can you see that? The muscles here. Can you see the muscles here? They are, students, they are intercostal muscles. They are intercostal muscles. Right, they are intercostal muscles. So we have external intercostal muscle. We have even internal intercostal muscle, right? And this is the diaphragm muscle that we need to discuss. Firstly, keep it in your mind, right? Firstly, keep this in your mind that what exactly you want, right? What exactly you want. You need to discuss the mechanism of breathing. You need to, if you want to inhale, you need to decrease the, basically you need to increase the volume of the thoracic cavity so that pressure can decrease. And that is why we are now going to discuss about some muscles. Is that clear? Is that clear? Yes or no? Yes or no? So that is what you have to discuss now. Any doubts? Yes, please. Any doubts? Sure. So let's talk about these muscles. Firstly, let's talk about the diaphragm muscle. Okay. First, let's talk about the diaphragm muscle. So I have discussed all the basic points here. Right. So now, yes, let's discuss about the diaphragm muscles. So as I said, it is something unique to mammals. So whatever you know regarding this, just do let me know in the chat section. Quick. What do you know about the diaphragm? Quick. Quick. Yes, please. Student done? So I was expecting that other than spammers, students are there to answer the question, but I think nah. So done. So it is what? So diaphragm is a muscular structure that separates thoracic cavity and abdominal cavity. That will separate what? Thoracic cavity and abdominal cavity. Okay. Right, its position varies. As right now I told you it is dome shaped. It is not mandatory that always it will stay like that. So we will discuss how that inspiration and expiration, right? How that inspiration and expiration, yes or no? Inspiration and expiration is going to change the position here. Is that clear? Is that clear? So what are we saying? That it is a muscular structure that is going to separate the thoracic cavity and the abdominal cavity. Is that clear? Yes or no? Is that clear? So it is a kind of, I would say it is a type of, right, skeletal muscle. Do you know that? It is a type of skeletal muscle. Do you know that? Right? Normally when it is working, it is involuntary, but when we can also use it forcefully, right? Yes, please. Yes, please. So diaphragm में we say, जैसे radial muscles are there, and for that we use the word phrenic muscle. So diaphragm is having these phrenic muscles, and let me tell you, diaphragm is very, very important for the inspiration, right? It is very important for for inspiration, that is for the inhalation, right? It aids in ventilation, that is in breathing overall. So we'll discuss it, right? We'll discuss it. And moreover, not just this, diaphragm can also help in micturition, that is passing out of urine. It also helps during the childbirth. But mainly, where do we discuss its role? We discuss its role in the, yes students, where do we discuss its role? We discuss its role in the, this, what do we say? In the breathing, right? So next is intercostal muscles. So let me explain you this first. And let me tell you that these muscles, and yes, so diaphragm, it contracts during inspiration. Okay? We'll write it again. It contracts during inspiration. So due to which it becomes flat, right? Towards anterior posterior axis. I'll write it again, right? So next is intercostal muscle. So see, just now I told you about the ribs. So let's see, these are your ribs. So in between these ribs, the muscles that we are talking, they are the intercostal muscles. Like that's not how they are arranged, but I'm just showing you here. So in between these ribs, you have the intercostal muscles. Now we have two types of, so for intercostal muscles, I'll use the short form ICM. So we have two types here. One is external intercostal muscle and the another is internal intercostal muscle. So here, obviously, these are the ribs. Like let's suppose these are the ribs. So outer side we have external. This inner side will have the internal one, right? We will talk about this first. Is that clear? Is that clear? Beta, it is also the peripheral muscle. You can call it as phrenic muscle. They are basically the radial muscle. So yes, it is also right, Komal, that it is the peripheral muscle as well, right? So don't just get confused, because these are words that we can also use interchangeably, or these are the muscles that we have in the case of this diaphragm. So mainly, what is the important for you to remember at this point of time, that when you are talking about the diaphragm, it is going to help in the inspiration process. So please focus here, right? Focus here. Don't type anything unnecessarily. Just focus there, right? And I believe that some students, they just type again and again, right? They just want the attention that their names should be taken, isn't it? Okay, so next is the external intercostal muscle. So it is also your inspiratory muscle. So you have diaphragm is also your inspiratory muscle. This one is also your inspiratory muscles. Why? Because this external intercostal muscle, right? It contracts during inspiration. It contracts during inspiration. So it is also the inspiratory muscle. Okay, it is also the inspiratory muscle, that is, it contracts during inspiration. So that is something that you have to keep in your mind. Okay, right? Is that clear? Is that clear? Sure. So between two ribs you have the muscles. You are calling them as intercostal muscles, and they are of two types. Okay, okay. Okay, done. So this part is clear. So I'm writing it here. So actually the space present between ribs is intercostal space. So the muscles present there are known as intercostal muscles. So external and the internal is there. And do remember it. I have seen students making the mistake here, right? I have seen students making the mistake here, that what they do, they just confuse it. They think that it is actually, just a minute, let me block some spammers. So they just think that it will be internal intercostal muscle if it is the inspiration. No, that's not the case. Just a minute, guys. Chaliye, let's go. Okay, So let's go. So external intercostal muscle, internal. So when the inspiration, what do you have, external or internal? During inspiration, which muscle is going to contract here? Yes, please. Yes, please. Just a minute, students. So they connect. Acha, dorsal surface of upper rib. So that is how they are located, right? So when it is the external ICM, right, the what is it going to do? So it is going to connect the dorsal face of the upper rib with the ventral face of the lower rib, right? And the other one, the internal intercostal muscle, will connect the ventral surface of upper lip. So let's write with the done. So connects the ventral face of surface of upper rib with dorsal face of lower rib. So that is how they are arranged. So one is external, another is internal. One is external, another is internal. So that is how it is placed. So you can see this, right? You can see this. So here you people can see the external muscles. You guys can see the internal muscle. So it is like, what is it going to do? So it will basically, external intercostal muscle will connect the dorsal surface of the upper rib to the ventral surface of the lower rib, and this one will connect the ventral surface of the upper rib with the dorsal surface of the lower rib. This is how it is arranged. Now, if you are clear with the position, now you have to understand one thing. Now, when these muscles are going to contract, look at their position. Now, see, now we will talk about the inspiration, and we will write all the points which will be there in the inspiration, like what exactly is going to happen in the inspiration. Is that clear? So inspiration, which is also known as inhalation. Is that clear? So first of all, students, it is an active process. What is it? It is an active process. So if I am saying it is an active process, what does it mean? It needs energy. It needs energy. This is the first thing that you have to remember. Done. Now, during this, what you need? We need to increase the volume of the thoracic cavity, and we need to decrease the this, right, pressure. So increase volume of thoracic cavity, that in return will increase volume of pulmonary cavity. Understood? And of course, if volume increases, pressure decreases. Which law it is? Which law it is? It is our Boyle's law. Done, students? Okay. So that's what we have to do. So, inspiratory muscle, again, direct PYQ. And these statements are actually like whether it is an active or the passive process. That's a direct PYQ. This one is PYQ. This one is PYQ. So inspiratory muscles, right, students? Inspiratory muscles. So here you'll talk about the diaphragm muscles, and external intercostal muscles. Why do we call them as inspiratory? because they contract during inspiration. So now what's going to happen? So obviously, right, that dance step, your diaphragm is like this. Your diaphragm is like this. Are you getting my point? Dome shaped, right? When you are not inhaling, it is dome shaped. Now your muscles, diaphragm muscles will contract. Your diaphragm will become flat. Your diaphragm will become flat. This is our first step. This is our first step. Diaphragm dome shaped, it will become flat. Diaphragm dome shaped, it will become flat. Now the next step, your rib cage is inward, downward and inward. Now when your external intercostal muscles will contract, you know that connected to upper, like basically present in between upper and lower rib. So what is going to happen? When that external intercostal muscles will contract, your rib cage will go upward, outward, upward, outward, upward, outward. So it is like this. First this, then this. First this, then this. First this, then this. That's how I remembered, to be very honest. Right? So let's write it clearly. So when it is the diaphragm, so muscles contract. So diaphragm becomes flat shaped, becomes flat, simple. So now let's suppose it was like this. It was like this. Now, if it will become flat, so don't you think that that will overall increase, right? That increases volume. And how will it increases volume? Towards anterior posterior axis. How will it increase? It will increase towards anterior posterior axis. This is the first case, right? This is the first step. Now the second dance step, external intercostal muscles contract. What will happen to rib cage? Outward and upward. So obviously that will also increase something. What will that increase? So that will, right, this position of rib cage increases the volume towards dorso-ventral axis. How will it increase? Will increase towards dorso-ventral axis, right? Dorso-ventral axis. Is that clear? Is that clear? Yes, so you can take it in this way. That is how it is going to. That is how it is going to. So basically when overall, when both these muscles, they are contracting, so overall your thoracic cavity volume, it will increase now towards dorsoventral axis and towards anterior posterior axis. Isn't it? Isn't it? So if volume increases, pressure will go down. So we can say that, right? So yes, we can say that during inspiration, the volume of pulmonary cavity increases, so pressure decreases. So what is going to happen to what will happen to pressure? Pressure will decrease. So we can say that lungs will have negative, intra means within, negative intrapulmonary pressure, right? Negative या फिर negative intrapulmonary pressure. So obviously air will come in, right? So this is the inspiration, students. It is an active process. These are the points that you have to take care, or basically these are the points that you have to remember. Is that clear? Is that clear? Yes, please. Quick. Is it clear? Sure? Sure? So inspiration is an active process, students. So on an average, this process is for how many seconds? You know that? 2 seconds. And expiration is for 3 seconds. Right? So on an average, you know that a healthy adult will go for 12 to 16. Right? 12 to 16 breaths per minute, basically. 12 to 16 breaths per minute. So this point is clear? This point is clear, everybody? Yes? So if there is any doubt, please do let me know, because you know that the opposite of it will do in what? In exhalation. Yes or no? Done? So of course, next is exhalation. That is again expiration. So when there is a normal exhalation or normal expiration, so students, it is a passive process, right? It's a passive process. It will go for 3 seconds. Okay, for how long it will go? Right, it will go for 3 seconds. So what's going to happen here? Normally, obviously, your diaphragm, if your diaphragm muscle will relax, then you know what's going to happen. Again, diaphragm becomes dome shaped, and you know that due to which what will happen? Again, volume decreases towards, or it will come to normal the way it was, anterior posterior axis. Number one, your external intercostal muscles, they will also relax. So rib cage, what will happen to rib cage? Downward and inward. That will be the rib cage movement, and due to which, students, the volume decreases towards dorso-ventral axis. Understood? Yes? So write down. Quick. Yes, please. So here what is going to happen? The intrapulmonary pressure increases. So now you know that intrapulmonary pressure will increase, so the air will go out, students. Air will go out. So that is how it works. So this is about the normal inhalation, normal exhalation. Now we will also talk about the forceful, right? We will also talk about the forceful exhalation or forceful expiration, right? We'll also discuss about the muscles of the additional muscles of the stomach as well. So you tell me. Yes, please. So now, students, when you are talking about the forceful exhalation, students, it is an active process. And here you will see the involvement of your inspiratory muscles, right? Inspiratory muscles as well as inspiratory muscles, and you will see your abdominal muscles to act, right? They are going to act. So when will it happen? Like let's suppose when you are doing some exercise, when you are even speaking too much, right, when there is the coughing or such kind of things are there, in that case this is going to happen, right? So what is going to happen in that case? In that case, you people will see that basically this exhalation, which we were saying as a passive process, will become active. It will be energy taking, number one. Secondly, what's going to happen, the inspiratory muscles, right, now they are also involved. They will also contract, right, because what we have to do here, we need to decrease the volume more so that pressure can be, so we need to decrease the volume so that pressure can be more. And the abdominal muscles, right, that additional contraction we will see there. So this is what exhalation is. Just normally, when without any conscious efforts, when we do this ventilation, then it is the tidal volume per breath. It is approximately 500 ml. But now it is the forceful exhalation, so it will show the expiratory reserve volume. Like when you are talking about this forceful exhalation, so per breath, this is what you are going to see. This is ERV. We'll discuss it. This is our next topic now. So we will talk about the expiratory reserve volume. What are we going to discuss? Expiratory reserve volume. So that will be around, I would say, like somewhere around 1000, right? So 1000 to 1200 ml per breath, right? It will be somewhere around, yes please, 1000 to 1200 ml per breath. Is that clear? Is that clear? Done, students? Okay, so that is it. So this is what we have to discuss. So when we talk about the abdominal muscles, so you have that rectus, oblique muscles, there are many that will basically move the diaphragm more inward. It is like that. So that's how it is going to help. So let's see this part. The diagrams are important, of course. So here you people can see when inhalation active, exhalation passive. So I'll share the notes as well. So see this diagram from the NCERT. Okay, so just have a look. Your air is entering the diaphragm. Look at the position of the arrows here. So diaphragm is contracted, it is coming down. So rib cage, it is going up. So ribs and sternums, they are raised, right? So the volume of the thorax increased. And here you see the exhalation is there, right? The exhalation is there. So here you people can see diaphragm relaxed and arched upwards. So ribs and sternum, they return to their original position. Diagram, the naming, each and everything is important here. Okay, each and everything is important here. Just keep it in your mind, students. Fine, just keep it in your mind. Okay, I hope it's done. Okay, so in detail I have discussed, right, not in a too much speed, right, in a very normal speed I have discussed it with you all. So here you guys can see this as well, right, that an increase in pulmonary volume, all the things are mentioned here. So relaxation of diaphragm, intercostal muscle, return diaphragm and sternum to their normal position, reduces thoracic volume, pulmonary volume, right, intrapulmonary pressure will be slightly above the pulmonary pressure, expiration will occur. So we can increase, this is again a direct statement, the ability to increase the strength of, right, the ability to increase the strength of inspiration and expiration with the help of additional muscle in the abdomen, right? So on an average, a healthy human breath 12 to 16 times per minute. So the volume of air involved can be estimated by using a spirometer. Okay, so spirometer will never help in measuring residual volume, right? You cannot measure the residual volume with it, but yes, you can measure, right, the other volume. So this is what now we have to discuss, that what is respiratory volume, what are the capacities. So that is our next topic. Is that clear, students? Yes, is that clear? Chaliye, so let's